Hi, today we gonna talk about nephrotic and nephritic syndrome. First, nephrotic syndrome, which is a clinical state characterized by heavy proteinuria, meaning increasing protein loss in urine, which leads to hypoproteinemia, and often associated with edema, which is the most common symptom, and hypocalcemia and hypokalemia. Causes are that all types of glomerulopathies, like minimal change disease, which is the most common in children, and focal segmental glomerulosclerosis, which is the most common in adults, and membranous glomerulonephritis, and mesangial proliferation, and membranoproliferative glomerulonephritis. These glomerulopathies may be primary, meaning idiopathic or we don't know the cause of them, or may be secondary to other diseases as diabetes mellitus, hepatitis C and B, amyloidosis, Alport's syndrome, and systemic lupus erythematosus. In nephrotic syndrome happens hypoalbuminemia, which is secondary to proteinuria, and may due to malabsorption, that is when gastrointestinal tract edema happens, as a result of decreased oncotic pressure as a result of hypoalbuminemia, and happens dyslipidemia, hypokalemia and hypocalcemia. As I said earlier, the patient comes with edema cause it the major symptom, may comes with muscle weakness and wasting, due to hypokalemia and proteinuria, and may comes with abdominal pain or loin tenderness, and may complicate to acute or chronic renal failure or arrhythmia or shortness of breathing. That was the nephrotic syndrome. Second, nephritic syndrome, which is characterized by acute onset of hematuria, and oliguria and hypertension and mild to moderate proteinuria, and edema. Mostly caused by post-streptococcal infection, meaning upper respiratory or skin infections, and may be secondary to other diseases as diabetes mellitus, amyloidosis, Berger disease, Alport's syndrome and systemic lupus erythematosus. In nephritic syndrome happens depression of serum C3 level strongly, and hematuria, which is blood in urine, and oliguria, and edema. Most common age of patients with nephritic syndrome are between 3 and 12 years old, meaning it's rare in adults and infants, and may come with fever, headache, loin pain, and mostly hematuria, and myedema and oliguria. That was the nephritic syndrome. Thank you for listening, I hope you learned something. Thanks again and subscribe for more.